The recovery process from robotic surgery does have a significant dependence on obviously what type of procedure is being performed. If you take one procedure and compare the recovery from traditional open surgery to traditional laparoscopic surgery to now the newer technology, robotic surgery, the recovery is much quicker. And that is really the main driving force behind becoming less and less invasive with our surgical procedures, is to make them less inconvenient, less painful to the patients that need an operation. My personal experience, I've seen some significant improvements in largely hernia surgery, specifically incisional hernias, which are on the front of the abdominal cavity. Patients had a previous operation and herniated through the incision from that operation. In straight laparoscopy, which still gives you a good repair, I would typically admit the patient to the hospital for around 2 or 3 days, largely for pain control. And I would tell them to expect 2 to 3 weeks of pain and around 4 to 6 weeks total of discomfort before they were completely over the operation. With robotic surgery now, it's become an outpatient procedure. The same hernia repaired with a robot as opposed to that repaired with straight traditional laparoscopy is able to go home the same day. They don't need 2 or 3 days in the hospital. Time course of pain for the patient has gone for me from around 3 to 4 weeks to 7 to 10 days, maybe 14 days. And the amount of time that the patient's required to restrict their physical activity has gone from 6 weeks to 2 weeks. So that's probably the best example I have of how becoming less invasive and using better technology, again, makes surgery, which obviously is inconvenient and painful, much less inconvenient, much less painful.